Welcome back and thank you for staying with eNCA. Now, diseases and viruses don't respect borders, and to combat outbreaks, collaboration is needed among health professionals. This was one of the aims of the second International Conference on Public Health held in Kigali in Rwanda. African leaders and health experts gathered to discuss continental challenges. Let's find out more now from Cochrane vaccinologist Duduzile Ndwandwe. Dudu, thank you very much for your time here on eNCA. Just firstly, I wonder what has been discussed in terms of the fact that during COVID-19, really the world got to see exactly how much backwards South Africa is with healthcare, or rather Africa is, with healthcare.
Yeah, firstly, thank you so much for inviting me to come and speak on this topic. Really, Africa and South Africa was left in the cold in terms of dealing with COVID-19. However, I must recommend the researchers in the whole region of how they have managed to pull through resources and be able to combat COVID-19, because we have done exceptionally well in terms of managing COVID-19. So we have the resources, we've got the capabilities in the African continent, and we should not doubt our capabilities of managing any pandemic that may arise in the near future.
And I mean, Doc, for me, one thing I remember, very clearly about what we went through during COVID-19 were our good scientists here in South Africa who discovered the Omicron variant and made it clear that the variant came into our borders. But the international world shut us out. They started treating Africans very badly during that time. So is it not clear then in your conversations at this conference that, the international world needs to treat Africa better?
Well, that's clear. I think one of the themes that are coming up in the conference is that Africa needs to unite. Africa needs to find solutions for their own problems, because really how the world has treated the African region, it's really appalling. And really we must commend the efforts of our scientists locally, that we have been able to have, pull resources, the limited resources that we have, to be able to manage the pandemic. But of course, it comes with the backlashes. It comes with, when you do better, there would always be criticism. And yeah, I mean, I think we did very well, but we must criticize what has happened with COVID-19 and also recognize that Africa needs to unite and stand on their own and be able to find solutions for themselves.
And any pointers on the monopoly or capitalism of the healthcare industry, where pharmaceuticals, etc., are making medication very expensive, and therefore it hampers on, accessibility, equal accessibility to quality healthcare for all in the world?
Well, I think that's a conversation that is throughout the conference. The issue of the costing of medication is on top of the agenda. How do we ensure that we have equity in our healthcare system? It becomes very fundamental. And also it even goes back to how we even conduct the research in the African region, because that puts us in the forefront of getting the medication, but the monopolizing of medication, it must not, what's the word that I'm looking for? We must call it out for what it is, because really Africa must be regarded as one of the continents that have done well and be recommended and applauded for their efforts with the limited resources that they have had.
And I mean, we have really good scientists, particularly in this region of Africa, called South Africa, where we've had lots of breakthroughs in the fight against HIV and AIDS, with our scientists making sure that they find ways to make it go in remission, right? So that a mother can donate a part of her liver to her HIV negative child while she's HIV positive without the child being put in danger. I think that is really brilliant work from our scientists here in South Africa, particularly at Wits University. But for us to always be considered last is quite unfair. But talk to me, Doc, about other illnesses. That's why I'm mentioning HIV at the moment. It's not just COVID-19. COVID-19 just happened to exacerbate how backward Africa is. Other illnesses such as your cancer, the treatment there is still very expensive, and we have the poorest of the poor dying at home because they actually cannot afford.
Mm-hmm. That's absolutely true. I mean, if you're talking about the cost and you're talking about treatment, we go back to the issue of equity in our healthcare. How does Africa position itself to ensure that there is local funding into our healthcare system that's building a resilient healthcare system to be able to withstand any pressure of any pandemic that are yet to come, but still be able to cater for the health needs of the people of this continent.